The highways that lead to the neurology clinic are indeed diverse. Many are incidental due to being in the wrong place at the wrong time. Others are when our genes seem to set us up to fail right from the beginning. Others are, however, self-induced by activities we indulge in, pleasurable or not. And amongst these human pursuits that can usher us into the neurology clinic is sexual activity, whether legitimate or clandestine. In this podcast, I will count down 10 sexually related disorders that can be seen in the neurology clinic or on the ward. But please note that in many of the outcomes I discuss here, sexual activity is often not the only or the main risk factor. As you shall see, this clarification is important to avoid jumping to the wrong conclusions. Number 1, Epstein-Barr virus associated syndromes. EBV is a very ubiquitous virus that is most frequently transmitted via the saliva. This is why it can be shared by sharing drinking cups, eating utensils, and toothbrushes, and by kissing. It is, after all, known as the kissing disease. And amongst its almost countless ravages in the nervous system are febrile seizures, meningoencephalitis, cranial nerve disorders, and autoimmune conditions such as transverse myelitis, acute disseminated encephalomyelitis or ADEM, and we're learning multiple sclerosis. Indeed, EBV is now considered to be the top risk factor for MS, a fact that is opening the door to the possibility of vaccination against this horrendous disease. Important point, sexual activity is not the main or the most important risk factor for multiple sclerosis. Number 2, HIV-associated neurological syndromes. Sexual activity is the major, but by far not the only route to acquiring HIV infection and AIDS. And it is already established that the transmission of the virus may be by both heterosexual and homosexual practices. A lot of the stigma on this account no longer holds. And the consequence of HIV on the nervous system is almost encyclopedic. And the roll call includes HIV-associated neurocognitive disorder or HAND, cerebellar degeneration, brain tumors, aneurysms, and a host of opportunistic infections. Number 3, monkeypox virus. Relatively new to the neurological scene is monkeypox infection, a zoonotic disease whose natural reservoirs are possibly small mammals and primates. Monkeypox is transmitted by close physical and sexual contact, but it is also spread by respiratory droplets and blood. It is endemic in the tropical rainforest of Central and West Africa, but it is also seen in non-endemic areas where it is most prevalent in homosexuals. With an incubation period of 7 to 21 days, it does not take too long for the skin lesions that characterize the infection to appear. But monkeypox also devastates the nervous system, causing such symptoms as headache, seizures, and confusion. Number 4, neurosyphilis. Unlike monkeypox and HIV, neurosyphilis is an ancient terrorizer of the nervous system. Although it can be transmitted congenitally during childbirth, syphilis is predominantly sexually transmitted. And it is no exaggeration to say that a lot of neurology was constructed on the back of syphilis, the ubiquitous and tenacious infection that leaves many scars on the nervous system. Neurosyphilis is almost unique in the way it establishes distinct neurological syndromes depending on how long the virus has resided in the brain or spinal cord. And these syndromes come with such exotic names as tabes dorsalis, general paresis of the insane or GPI, taboparesis, and meningovascular syphilis. One would think neurosyphilis should be only of historical interest, but the dreaded syphilis bacterium has defied the odds and continues to flourish. Number 5, Lemiere's syndrome. This is infection and clot formation, technically called thrombophlebitis, in the internal jugular vein, which is one of the big veins that drains the head. And the bacterium that causes this infection bears the terror-evoking name Fusobacterium necrophorum. And it is an equal opportunity bacterium that can be transmitted in all sorts of ways, including by sexual contact. And its usual first port of call is the airway, where it causes pharyngitis, from where it finds its way to the internal jugular vein. And among its effects on the brain are brain abscesses and meningitis. Number 6, Elsberg syndrome. This is an acute or subacute inflammation of the nerves that exit from the lower spine, technically called lumbosacral radiculitis. It also often is associated with inflammation of the lower spinal cord, technically called myelitis. And although many viruses can cause Elsberg syndrome, the classical one is herpes simplex virus type 2, usually a reactivation but occasionally as the primary infection. HSV2 is of course notoriously and predominantly transmitted via sexual contact. The typical patient with Elsberg syndrome is someone who has previously had genital herpes infection and who then develops fever, urinary retention or incontinence, constipation or diarrhea, saddle anesthesia, which is numbness in the perineal region, and lower limb weakness and numbness. Number 7, headache associated with sexual activity. Many catastrophic disorders can give rise to headache developing during sexual activity, and these include a ruptured aneurysm and a tear or dissection of the basilar artery at the back of the brain. But in cases, the headache is benign with no identifiable cause. Neurologists call this primary or idiopathic headache associated with sexual activity. And they have even come up with criteria to diagnose this. Amongst these is that there must have been at least 2 episodes of head and or neck pain brought on by sex or masturbation. The headache may start before orgasm and increase in intensity with sexual excitement, or it may have an explosive thunderclap onset at orgasm. Curiously, it does not occur with every sexual encounter, and it may be brought on only by specific sexual practices. Number 8 is sexsomnia. This refers to sexual behaviors that emerge during sleep, and these range from fondling and masturbation to sexual intercourse and spontaneous orgasm. The episodes may also be associated with aggression, violence, and inappropriate vocalizations. The victims, some will say the assailants, usually are young men with a mean age of 32 years, and they have no recollection of the event. Yes, they are not feigning ignorance. Sexsomnia may be triggered by such medications as sodium oxybate, so it is important to look for an external trigger in all cases. Number 9, delusion of sexual transformation. This is the delusion that a person has been transformed into the opposite gender. I confess I've only come across one case report of this delusion, but in that case it was a person with a tumor in the right amygdala. Number 10, Klein-Levin syndrome. This is a disorder characterized by bouts of excessive sleeping and eating, and it predominantly affects adolescent men. It may be genetic, but it may also be provoked by such triggers as infection, traumatic brain injury, stroke, and multiple sclerosis. Beyond its core features, Klein-Levin syndrome may also manifest with bizarre sexual behaviors, amongst which are unwanted advances, indecent exposure, fondling the genitalia, and hypersexuality. So when a stalker strikes, a neurological consultation should be on the cards. Thank you for listening or watching this podcast. If you found it enlightening or perhaps even entertaining, don't forget to click on the like button. And why not subscribe to the YouTube, Spotify, or Apple channels to make sure you don't miss the next episode of the podcast. And whilst waiting for the next episode, why not check out my book called Surfing the Brain? And if you want more hard facts about neurology, check out my neurology database called Neuro Checklist. Thank you very much for your time.